Hello everyone. In this video, we are going to discuss about one very important low-cost intervention that has helped in improving newborn survival, kangaroo mother care. Kangaroo mother care, or KMC as we call it in short, is a technique of providing skin-to-skin contact to the newborn baby. In this technique, the newborn baby is placed on the mother or father or any family member's chest, making sure that the baby and the family member are in skin-to-skin contact. The baby can remain in this position for any amount of time, provided the family member is available and is willing to provide KMC. This has not only the benefit of improving the emotional bonding between the baby and the family, but it also has number of medical benefits. KMC began as a simple and low-cost, easily available intervention in a city called Bogota in Colombia. This was started because of the high incidence of prematurity related mortality. That is, a lot of preterm babies were dying in this place for a lack of availability of equipment such as incubators and warmers which could keep them warm, because of infections, and simply because there was lack of available proper medical attention. So when KMC was begun in this place, they witnessed a dramatic decrease in neonatal mortality. Today, KMC has evolved as a very evidence-based and simple intervention which can improve newborn survival and save so many newborn babies, not only in the resource-depleted settings or low-resource settings, but also in the most advanced of countries and in the most advanced NICUs. As we discussed, kangaroo mother care is associated with a lot of medical benefits. To begin, KMC improves the newborn baby's vital signs, that is, respiratory rate, the heart rate, oxygen saturation levels, the breathing pattern. The newborn babies begins to breathe in sync with the mother or the father's breathing, and studies have shown that all these vital signs, saturation, heart rate, respiratory rate, all these vital signs begin to improve by doing KMC. The babies have lesser risk of developing apnea or sudden cessation of breathing. The babies also can achieve better temperature, so the incidence of hypothermia or low temperature is much lesser with KMC. KMC also decreases the chance of the baby developing infections, and it improves the baby's immunity. It also improves the rate of exclusive breastfeeding, that is, the percentage of babies receiving only mother's feeding by the time they reach 6 months. All these benefits culminate in better weight gain and earlier discharge in those babies who are provided kangaroo mother care. KMC is also associated with a lot of benefits to the mothers. Importantly, it boosts the confidence and the emotional bonding of the mother and the baby. It improves the ability of the mother as well as father in taking care of the baby. Again, for mothers, the important benefit is mothers can produce more volume of breast milk while providing KMC. It also helps the mother to have better confidence in taking care of the baby's needs even after discharge. Let us discuss now how is KMC practically provided. So it is important that the family member is comfortably seated in a relaxed position. There are specially available kangaroo mother care chairs which can be made available in the newborn unit as well as in the specially made KMC ward or also at home. Next, it is important to ensure that the care provider wears a front open dress so that it is easy to place the baby over the chest. So it can be made in the form of a hospital gown which has a provision for providing KMC, or there can be front open gowns or nighties for mothers who are willing to provide KMC. The third step is to place the baby over the mother's chest in a frog-like position. So the baby's head must be well supported, the neck must be in mild extension, and both the baby's hands as well as legs will be placed in folded position, ensuring that the baby is in skin-to-skin contact. The baby also must be wearing a cap or a hat, and the diaper can be placed during KMC. It is important that the baby also has a front open shirt. After placing the baby in KMC position, you cover the baby as well as the care provider with a blanket or a gown, making sure that the baby does not become cold. KMC can be provided as long as the baby as well as the provider being KMC are comfortable. A typical session for KMC must at least last for 60 minutes. Such sessions can be done multiple times in the same day, provided the baby, the care provider as well as the nurse who is taking care are available and it is feasible for them to provide KMC. There are very few medical conditions in which KMC may not be possible. For example, a sick newborn who is on high settings on ventilator, it may be difficult to do KMC. Or a baby who has umbilical lines, umbilical venous or arterial lines, it may be practically difficult to do KMC. Barring these very few situations, it is possible to provide KMC for most of the other preterm low birth weight newborns. Newborns who are receiving IV antibiotics or who are receiving IV fluids or maybe on minimal oxygen support, or who may be receiving non-invasive ventilation like CPAP or high flow nasal cannula, all these babies are very much amenable and are good candidates for providing kangaroo mother care. Till what age must KMC be continued? KMC can be continued until both the mother and baby are comfortable. Usually, good weight babies, say babies who have crossed 2.5 to 3 kilograms, usually may become uncomfortable during KMC and they may wriggle out of that position. When that happens, KMC can be stopped naturally, but barring this, KMC can be continued as long as the baby and the mother are comfortable. Thank you.